Hello everyone, this is Dr. Ngatu Lando Roger, Associate Professor of Public Health at the University of Kagawa, Japan. Our presentation is entitled Air Quality in the Working Environment and Respiratory Health of Women Stone Quarry Workers in DR Congo, Africa. We do not have a conflict of interest in relation to this study. Introduction. Reports from WHO and UN Environment Task Force show that air pollution is a major threat to human health, and ambient air pollution, AAP, is considered as #1 environmental health risk factor that causes over 7 million deaths annually. There are several sources of AAP with impact on respiratory health in humans, such as mining industry, cement factories, construction industry, and petrochemical industries, and also road traffic related pollution. Informal quarry worker has been spreading among women in Africa, particularly in the Democratic Republic of Congo, in a context of severe poverty. The objective of this study was to investigate the impact of occupational or environmental exposure to air pollutants in informal quarry sites on the respiratory health of female stone quarry workers in the town of Lubumbashi, southern area of the Democratic Republic of Congo. For the methods, these figures shows the geographical location of our study site in the southern part of DR Congo. And on the left side, we have the map of the Africa's Copper Belt area, which is between Congo DRC and Zambia. For the study design, this was a matched case control study, and there were 512 workers, women workers, among them stone quarry workers and office workers, tax collectors. Exposed group was comprising 256 quarry workers who were matched to the controls. Unexposed group or controls were 256 female market tax collectors and office workers. We realized some measurements. First of all, we conducted a health survey using a structured respiratory health questionnaire, and the participants underwent physical examination, lung function testing using the peak flow meters, which replace spirometry. We also conducted air quality assessment at the work sites of women who participated in this study. We use BRAMC air quality monitor, which helped us to measure the concentration of air pollutants such as PM2.5, PM10, and volatile organic compound, VOC. This slide shows the quarry work sites in Lubumbashi, in Congo DRC, with women working at this site during the dry season when it's hot in a dusty environment. This is the site where our study was conducted. Now we would like to summarize the main results of our study. Table 1 shows the socio-demographic characteristics of the study participants. We observe a higher proportion of exposed women, quarry workers, who worked longer, about 12 hours a day, and most of them had a low education level and presented abnormal lung auscultation during the physical examination. Also, compared to the control group, quarry workers had a lower proportion of smokers. This slide shows the result of lung function testing using the peak expiratory flow meter. We observed that exposed workers had reduced lung function capacity as compared to unexposed controls. Table 2 shows the result of logistic regression analysis with adjustment for social demographics. The association between respiratory complaint and dust exposure at quarry sites. We found that almost all respiratory complaints were associated with quarry work. For example, wheezing after effort, morning cough, breathlessness at rest, breathlessness after effort, chronic bronchitis, and chronic rhinitis were positively associated with dust exposure at the quarry site among women from the exposed group as compared to women, office workers, and market tax collectors. For the discussion, our study showed higher levels of atmospheric PM 2.5 and volatile organic compounds in the quarry sites. Also, the respiratory complaints were more prevalent among Congolese women quarry workers as compared to unexposed workers. Almost 10 times higher prevalence was observed among exposed workers. And the lung function capacity was markedly reduced among stone quarry workers. As recommendation, there is a need to regulate stone quarry work and improve occupational safety in this sector. And quarry workers should use personal protective equipment, PPE, in order to protect their respiratory health. Thank you very much for your attention. Kamsa Hamnida.